Hello, everyone. Welcome to our presentation on life in the green zone. My name is Sarah Ryland.
And my name is Paige Thompson, and we are both physician assistant students from the University of Pittsburgh. Before we start, I just wanted to explain that PAs are medical providers that work with physicians to provide medical care. We can diagnose and treat patients, assist in surgery, and prescribe medications. We work in all health specialties and increase access to affordable health care. And so we're going to use some of the knowledge that we've learned as students in our physician assistant program so far to talk about life in the green zone today.
And Paige and I are looking forward to doing a lot of projects in the future with the Homewood Community Engagement Center. But for now, since everything is online or virtual, we thought this would be a good way to get started. Okay, so in the green zone, it looks like this is going to be our new normal for a while. Restaurants, bars, barbershops, and salons can operate at 50% capacity. They do recommend appointments or reservations just so they can be ready for the amount of people that they're going to have each day. Gatherings of over 250 people are prohibited. And even though the stay-at-home order has been lifted, social distancing and staying home is still recommended. Masks are also still strongly recommended, and they're mandatory at many public places. And so with that, we're going to go a little bit more into the benefits of wearing a mask.
So we wear face masks to protect ourselves and protect others. This is in case we have the virus but are not yet experiencing symptoms, or maybe we are an asymptomatic carrier of the virus that we can still transmit particles to others. So we just came up with a few do's and don'ts of wearing face masks. So do keep the face mask on the entire time you're in public. This includes going into the grocery store, different stores at the mall, and while using public transportation. However, don't touch the mask or your face without washing your hands. Do make sure it's covering your nose and mouth. This is really important because we've seen a lot of people just wearing the mask around their mouth, but it's important to cover your nose as well. Although it can be a little uncomfortable, you can transmit and receive viral particles via the nose as well. However, don't pull the mask down to your neck or up to your forehead because this could spread germs over your face. Do provide and assist children 2 years and older with face coverings, but don't place a mask on a child under 2 years old. This is not recommended by the CDC.
So I just want to talk a little bit about where the 6 feet comes from. COVID-19 typically spreads from an infected person who is talking, coughing, or sneezing droplets from their mouth or nose into the mouth, nose, or lungs of someone nearby. So 3 to 6 feet is how far these droplets can typically travel from a sneeze or a cough. So staying 6 feet apart is recommended to definitively protect yourself and your family when either someone else is not wearing a face mask or when you're not wearing a face mask. There's no way that those droplets could reach you. And I like this graphic on the right. It just shows how far 6 feet is. It's a nice way to visualize. Everyone knows how big a couch is, so just imagine placing a couch between you and the person near you. And we do realize that this is not always possible, say in a crowded store or on the bus, but this is why we do recommend face masks when possible when you can't stay 6 feet away.
So to go briefly into the etiquette of wearing a mask, I liked these two graphics provided by the CDC. So I know that you all have probably seen similar graphics on the internet or on different signs around town, but just to go over it briefly, when putting on your masks, make sure to wash your hands before putting it on. Put it over your nose and mouth and secure it under your chin. Try to fit it snugly against the sides of your face, but obviously this is not like always possible depending on the mask. And make sure you can breathe easily. It shouldn't be incredibly hard to breathe in a mask. If you are homemaking them and putting a lot of layers in, this could make it harder to breathe. It may be a little bit more difficult to breathe, but it shouldn't be impossible to breathe when wearing a mask. And then when taking off your face mask after you get back home, make sure to remove it by untying the strings behind your head or stretching the ear loops. So remove it by these strings or loops in the back and handle the mask only by these parts. Fold the outside corners together and place the covering in the washing machine, or if it is disposable, dispose of it. Be careful not to touch your eyes, nose, and mouth when removing, and then wash your hands immediately after removing to avoid contamination.
Even when we're not wearing a mask or when you're just at home with family and friends, we want to make sure that we're following cough and sneeze etiquette and also proper hand washing. So we want to make sure that we're covering our mouth and nose with a tissue when we cough or sneeze, and then immediately disposing of used tissues to prevent spreading germs to others. Avoid touching your eyes, nose, or mouth with unwashed hands, and then wash your hands with soap and water or use alcohol-based hand sanitizer as soon as possible after coughing or sneezing. And just a little note about proper hand washing: soap and water for 20 seconds, and the friction between your hands to scrub away germs is the best option, especially if your hands are soiled. And the temperature of the water doesn't matter too much. It's the scrubbing and the rinsing the germs away that is really effective. And using hand sanitizer that is at least 60% alcohol can be effective when you don't have access to soap and water.
So Sarah and I mentioned a few places that you will have to wear masks or you may have to utilize in order to get around, and this includes public transportation. So we just wanted to review some of these topics briefly again. So on public transportation, make sure you're wearing a face mask or cloth face covering to protect yourself and other passengers. Keep yourself and children 6 feet from other passengers if possible, and this is especially important for children under the age of 2 who should not have a mask or face covering on. Avoid touching unnecessary surfaces and teach your children about keeping their hands away from their face and also from touching unnecessary surfaces on the bus or T. Avoid touching your face, eyes, nose, or mouth while in public, and wash your hands with soap and water as often as you can for at least 20 seconds after returning home, or if you have the opportunity to while you're out and about.
So when we're grocery shopping, a lot of the same rules when we're using public transportation also applies to grocery shopping or going out to other stores in public. This includes wearing a face mask or a cloth face covering to protect yourself and other shoppers. Many stores ask that patrons stay 6 feet apart while they're shopping or they're waiting in line. And many stores also have things like designated exits and entry doors or aisle directions. So make sure that you're following the store's guidelines for those. Avoid touching your face, eyes, nose, or mouth while in public, and then wash your hands with soap and water for at least 20 seconds after you return home. Make sure you're washing unpackaged produce, so things like apples, cucumbers, things that are just like loose and a lot of people might be touching. Try to wash those before eating. But according to the CDC, wearing gloves is not necessary and sanitizing groceries is no longer necessary. So you don't have to be wiping down boxes of cereal or packages of cookies with Lysol or anything like that. And I also wanted to talk a little bit about caring for children. Paige mentioned that children should be wearing masks, but children under 2 don't necessarily need to be wearing masks. And we just wanted to note some other things. So try to clean children's hands often with soap and water or hand sanitizer. Try to teach and model good hygiene habits. They are much more likely to do it if they see you doing it and see a good example of good hygiene. Try to keep children 6 feet from others while in public if possible. Again, we understand this isn't always possible on a busy bus, but when possible, try to do that. Clean and disinfect high-touch surfaces such as tables, chairs, doorknobs, other things in your home that are constantly being touched by multiple people. Try not to share dishes, drinking glasses, cups, or eating utensils, just to cut down on the amount of germ sharing between people in your house. And then doing laundry and washing items regularly, especially clothes or toys that were worn in public or brought on public transportation. And lastly, try to encourage outdoor play. It's much less likely to spread the virus while outside. So outdoor play is great for kids. Just maybe steer clear of really crowded playgrounds or parks if possible.
So, as we start to re enter society a little bit more in the green zone, I just wanted to talk about the relative risks of public activities. So, I got this information from an article from NPR called From Camping to Dining Out. Here's how experts rate the risks of 14 summer activities. You can see that they are graded from low, medium to high risk. And the lowest on the list include going to beaches and pools, exercising outdoors, and camping. So, attending beaches and pools are considered relatively low risk, especially if you maintain the social distance of 6 feet. In addition, you can reduce the risk by not letting your kids interact with others and avoid crowds at bathrooms or entry points. In terms of exercising outdoors, non-contact sports like golf and tennis are safer than contact sports like basketball or football. And you can also reduce the risk by avoiding crowded paths while walking or running outside. Camping, the risk is low if you're camping with others who have followed social distancing guidelines. You can reduce the risk by avoiding crowded campgrounds, shared restrooms, and communal picnic areas. In the low to medium risk category, we have a backyard barbecue with one other household. And so the risk is low if the attendees have followed social distancing. You can reduce the risk by making it BYOB and not sharing food, drinks, or utensils. In terms of shopping, the risk varies based on the crowd size, and especially as the shopping malls start to open up, you can reduce the risk by avoiding the food court and shopping at outdoor malls when possible. With hotel stays, you can call ahead and ask about the hotel's COVID-19 cleaning policies and reduce the risk yourself by cleaning surfaces, avoiding common spaces, and using your knuckle or pinky to press the elevator buttons. In the medium to high risk category, we have going to restaurants, getting your haircut at a salon or barbershop, and going to outdoor events with over 10 people. For restaurants, the risk depends on the individual restaurant precautions, and again, you can call ahead and ask about them to the restaurants that you are interested in, and you can reduce the risk by choosing outdoor seating, takeout options, or drive-through. For salons or barbershops, this is considered medium to high risk because you can't avoid having close contact with a hairdresser or barber. You can reduce the risk by both of you wearing face masks while you are getting your hair cut and finding a place with policies to protect employees as well as customers. In terms of outdoor events with greater than 10 people, the risk continues to increase with the more people that attend the event. This may not be safe for elderly guests or those with underlying conditions, but you can reduce the risk by reducing the size of the gathering and trying to social distance at the gathering when possible. The highest risk activities include indoor religious services and nightclubs. Indoor religious services, like going to church, are risky because you are singing. Some people sing in these services, and that increases the release of potentially infectious droplets. You can reduce the risk by wearing a mask, remaining 6 feet apart, and not sharing worship items at these services. Nightclubs, in addition, are considered high risk because of the crowds, close contact, singing, and the presence of alcohol, which may make people less compliant with social distancing. So again, this is from an NPR article that I will link at the end of the presentation, but I thought it was just helpful in assessing different types of activities that you can judge for yourself before going out.
Okay, I just wanted to address a few myths that I've seen circulating around, and these myths and the facts were adapted from an article from the World Health Organization. So the first one is proper use of masks does not cause oxygen deficiency or CO2 intoxication. I know it's annoying to wear masks all the time, but it is safe. You won't get CO2 poisoning or an oxygen deficiency. A good example of this is people who wear masks for their jobs all the time, like painters or people who work in the OR. As I said, it is annoying, but you'll do just fine, and hopefully we'll all get a little bit used to it. The second one is spraying or ingesting bleach or other disinfectants is not protective against COVID-19, and it can be harmful to your skin and digestive system. So we don't want to see anyone get chemical burns or anything from trying to disinfect their skin. Soap and water will do just fine to remove germs from your hands and skin. Third, hot water and high temperatures will not protect you from the COVID virus. This includes hot baths, extreme temperatures, and long sun exposure. Again, the best way to prevent getting the virus is hand washing and social distancing. Although it is yummy, there is no evidence that eating garlic or spicy foods is protective against COVID-19. And lastly, COVID-19 is not spread via mosquitoes or houseflies.
Finally, we just wanted to give some notes on general health maintenance. So we advise you to keep or continue to schedule your regular visits and appointments with your various physicians. The census is relatively low right now, and the offices are prepared to see you again. It's important to monitor chronic conditions such as diabetes, high blood pressure, and asthma. So it's important to keep up with these appointments, especially now as we start to open up in the green zone. You will most likely need a mask upon arriving to the office, but you can always call ahead to ask about the office's policies in preventing COVID-19 transmission. In terms of imaging and lab visits, the labs and imaging centers are open and ready for patients. You will most likely have to wear a mask, but if you need to get any blood work done or get any scans done, you are able to do that now. In addition, ensure that the children under your care are receiving their scheduled vaccines and going to their scheduled well child appointments. It's important that we do our best to make sure that our children don't get COVID-19, but it's just as important to make sure that they don't, that they get the proper protection against preventable diseases that vaccines will give them. And then finally, if you or your family member or your friend is experiencing a medical emergency, please go directly to the emergency room. These emergency rooms are open and ready to take care of medical emergencies, such as various injuries or symptoms of a heart attack, stroke, or something like that. So please utilize the emergency room if you need to. We just wanted to pause here. These are the resources that we use to compile the information for this presentation. So if you wish to use any of these, feel free to screenshot this right now.
Okay, and lastly, we just wanted to say thank you for watching this video and keeping yourself updated. Paige and I are really looking forward to working with the Homewood Community Engagement Center in the future, hopefully in person someday soon. So
thanks again for listening. Have a great day and hail to Pitt.